Hello everybody and welcome back. We are going to continue the afternoon with an esteemed panel. So as we've all been talking about, today's focus is really about medical innovation, clinical excellence, and of course the future of aesthetics and what that really looks like. So we're going to be exploring where medicine, innovation, and aesthetics are heading. Right now I'm going to introduce our esteemed panelists. Of course, we have June Gordon with us, and we also have Rita Rubab, and we also have Dr. Ayman El Attar with us. Let's give a round of applause. Okay, so I'm going to kick things off. June, please tell me a little bit about yourself and your expertise.
Hi, my name is June. I'm with the Plasmatology Group. I am the lead clinical trainer for their innovative technologies, and I also have been in the industry about 40 years. So I've seen a lot that's taken place, the growth and the innovation.
Bringing lots of perspective. Rita, tell us about yourself.
So my name is Rita. I actually run two training institutes, one for medical aesthetics and one for aesthetic medicine. And we specialize in trainings with industry leaders. We provide one-on-one trainings, group trainings, and master classes as well.
Okay, thank you. And we also have Dr. El Attar. I know you spoke a little bit earlier, and we had that fantastic demonstration. Tell us a little bit for people who are just joining us now.
Yeah, I'm Dr. El Attar. I come from New Jersey, New York area. I'm the current president of the American Aesthetic Association. I've been in the field of aesthetic and medicine and surgery since 2002. And I'm current president of the American Board of Cosmetic Gynecology.
Fantastic. Okay, we're lucky to have our esteemed panelists with us here today. I want to kick things off talking about how this industry specifically has evolved tremendously. And again, you've been in the industry for some time, you've seen it evolve. Where do you think it has landed today? Where are we at today in terms of what people want and what people are serving or offering?
Let's just start as simple as that. Humans lived on Earth for 300,000 years. Everything that we take for granted as a sign of technological advancements like your iPhone or your airline travel or electricity happened in the last 100 years. Currently, medical information with the induction of AI have exponential growth, so as the longevity of humans worldwide, not only in Canada or United States or developed countries, but even in developing countries, there's a trend of more longevity. And with more longevity comes the need for more health and more proper quality of life. The definition of health by the World Health Organization have changed from just no disease to complete physical, mental, social, and sexual well-being, not merely the absence of disease or infirmity. Mm-hmm. And I think aesthetic medicine, regenerative medicine, and soon to come very popular senolytic medicine or age reversal medicine is going to be the new trend 2027 and more.
Wow. Nice. What about for you, June? What do you think?
I do agree with Dr. El Attar. I'm also seeing that there's more knowledge accessible to the patient, the end user, the people that are going in for our treatments. They're able to know what they want and are able to be more educated when it comes to our systems and our practices.
Mm-hmm. And speaking of education, Rita, that's something that you dive into and know well of as well.
So in terms of education, I do feel like now with young injectors, and me being myself very young, a lot of injectors come from seeing TikTok trends, which is actually kind of crazy because they want to learn about exosomes, they want to learn about salmon DNA, and VAMP is what we use in Canada. It's from Prolenium. So I feel like with aesthetic medicine advancing, these things and these trends and everything with new injectors is honestly the future of aesthetics, because it's not just a TikTok trend, it's more so evidence, it's backed up by evidence as well. And it's not just used by nurse injectors, like also doctors, medical professionals, they're using these treatments worldwide as well.
I love this concept of worldwide, and Dr. Tar, I'm sure you have, again, like from your experience, it's so interesting to see what's done across the world, and I think with social media and access to that, people have a preview of, oh, I want that done here, or I want to know more about that. You know, what is your experience in terms of where we sit right now, or what's available all over?
I think when I graduated in '87 medical school, it was much easier for us because with the invention of the World Wide Web in the 1990s, now we have the social media. And the social media is a sword with two edges.
Right.
The first edge is that it allows patients to have more knowledge about procedures, sometimes even though more than the provider, because they spend the last 6 months of their life studying pecectomy because they want to remove the buccal fat pad, while the plastic surgeon they're going to visit is not practicing that. He doesn't know anything about it. On the other hand, it is unfortunately a very uncontrollable medium for propagating hypes and things that's not supported with any kind of scientific data, peer-reviewed studies, controlled trials, and promise so many things to the patients, and then the patients come and ask you to deliver miracles that's not supported with any kind of scientific basis. So this is how I look at it. But definitely the presence of social media, the presence of very powerful influencers with millions of followers is something that we consider in medical practices or in plastic surgery and cosmetic surgery practices to be of significance. The other point too that in a very recent investigation by New York State, where we have one office in Manhattan, 15 med spas have been investigated about their practices. 60% had no liability insurance to cover their procedures. 75% of them were practicing without any kind of license. And 85% of the providers have no background or no certification. So this is where the authorities that control these med spa practices have to step in for protection of the consumers. For example, there's a lot of them providing medications that is outsourced from other countries for saving $1. They don't have any regulations how to store the medications, what's the expiration date on the medications, including Botox, fillers, weight loss medications, exosomes, all kinds of things. And at the end, the consumer is the one who is paying the price.
Right.
So again, the spread of social media and the spread of influencers and so forth educate patients about many things, but the same token, it's just something that's concerning when patients fall to a wrong person who is not properly trained about how to deal with treatments and how to deal with complications, because we end up seeing these things of mishaps.
We're going to get into a lot of what you were just saying, but as a clinic or as a doctor, how do you manage then the client's expectation walking in when they're going online and looking through all these things saying, I want that, and with your expertise, you're saying, I'm sorry, like, we don't perform miracles here, or this isn't what's best for you. How do you break that down and kind of reveal what is actually real? Yeah, exactly, June.
I do agree. It's everybody wants to look like this person on their phone.
Right.
And most times, if you're with your clientele that you have a relationship with, you're able to be honest with them. You're able to discuss with them the pros and cons of their expectation and set a proper expectation. That is very, very much most important out of the gate for any of the treatments that we do. Setting those expectations so when they go home, when they come back in 30 days or 60 days or whenever, we're meeting that expectation. Be truthful.
Be truthful. What about like the newest and greatest? You know, someone walks in and I want to try this treatment, and say maybe the clinic or doctor doesn't do something like that. Like, is that enticing then for a clinic to start adopting, or learn that, or start providing that with more people coming in and asking for it? Or is there like a line that's drawn again with what's trendy and what's actually going to help people achieve the results?
We are in a very competitive field because I remember when I started doing aesthetic medicine and surgery in 2002, I was pretty much the only provider who injected Botox and did laser hair removal in the central New Jersey area. Now, every corner around me have a spa or probably a hair salon where these treatments are performed in the back room. So it's really a big challenge. So we have to differentiate here between hype and medical facts. Because this industry is evolving, even with the manufacturers, even with energy-based devices companies, they always want to add something. Look at your iPhone. iPhone was invented 2007. Now we have iPhone 17, right?
Yeah.
I'm carrying iPhone 13. My daughter has the 17. What I'm saying is that they always try to evolve new technologies in order to keep the medical field purchasing more and more, so they stay in business. But when it comes to medical procedures and popularizing something brand new on social media through probably influencers or people who are spokesperson of the company, or publishing a very small group of patients by an industry-sponsored study, that give the impression, the false impression of safety to the consumers. But looking historically to things that have been used for decades, and it's evolving and it's been safe and have reproducible results, these are things that we call innovations. But we have to differentiate new hypes that is not cleared by the FDA, that is not approved by Health Canada, with skepticism. And falling into that trap and trying to just satisfy the patient request without these bases of reliability, basis of reproducibility, basis of evidence-based background in case things happen, will put you liable into liability, because you are the one who's going to be answering to those patients. So this is a very important warning to everybody who's stepping into that field. Proper training, use something that is reproducible, supported with medical evidence and evidence-based publications, not by the companies, but independent peer reviews. And that is something that you have to stick to. Let's always remember, body dysmorphic disorders in general medical practice is 1.8 to 2.5%. Aesthetic patients who are coming to improve their outlooks, by statistics and studies done by psychologists, have much higher body dysmorphic disorder percentage, up to 15 to 20%. So we have to filter those patients who are asking you for unrealistic outcomes from limited resources. I'm just giving you an example. Now we're living in the era of weight loss medications.
Of course.
We're seeing a lot of Ozempic faces, Ozempic butt, Ozempic breasts with skin sagging. So there's a huge difference between somebody whose skin sagging is in millimeters that can respond to heating with an energy-based device versus somebody who's sagging in centimeters that needs surgery. And we have to tell the patient in the consultation and assessment the real honesty, because explaining pitfalls in the consultation is knowledge, but explaining pitfalls in the follow-up visit after you charge them is the beginning of a lawsuit, a refund, or a bad review on Google, and you cannot get rid of that. So this is my just input about these new innovations that keeps coming. It will continue to keep coming up, because the industry has to move with new innovations. But some innovations are based on real scientific work, and some innovations are based on influencer opinion or push, and you never know what the push is. It financial because they're getting rewarded, whatever, but the consumers don't know that. So this is very important to keep in mind.
So with that being said then, from a medical perspective, where do you think clinics are most exposed nowadays, where you can kind of see through that differentiation?
Yeah, I would actually want to add on to what he said. So basically at our clinic, a lot of walk-in clients come. I mean, I shouldn't be saying this publicly, but they ask us, they're like, hey, we'll pay you extra, but can you give us Ozempic? Like young girls.
Wow.
And I'm like, obviously, we can't do that. We're not even allowed to do that. But they're so desperate for Ozempic that now they're ordering it through Korean suppliers. And it's not even real Ozempic, but it's just they see Kylie Jenner using, so again, social media. They see Kylie Jenner using it, and she has that, even though she's gotten surgeries. But it's just they see her using these products, and all these young women, even older women, they come in, and not just women, I would say males as well. So at my clinic, we actually get a lot of phone calls from males that are okay taking Ozempic and even Mounjaro. But now that we look at it, those are specifically made for a certain reason. And the fact that people are using them for weight loss, there's studies that have come out that, they prove that it affects bone density and also vision loss. Now, vision loss, I can't confirm that because I'm not a doctor. But I mean, I've read a few reviews, articles, and it seems pretty legitimate. I mean, I don't think it's something that I would recommend to any of my clients. But again, social media, it's made people so desperate that they will literally do anything for Ozempic, and they're okay with even taking like fake Ozempic from like Korean suppliers or Chinese suppliers because they just want to, they want to fit in.
Yeah. That psychological element, I think, is like huge and such an easy vortex to get kind of like wrapped into. And then as a clinic, I can imagine, or a doctor, you are, it's a very fine line of making the right choice for the consumer and what's right, but also it's a business, and you also need to be a business at the end of the day.
It's true.
Right?
Very much so. There's also, we're in an era where there is a lot of clinics. There's a lot of accessibility. So if you're not going to be able to provide,
So they're going to go
they're
elsewhere.
going to the neighbor, and the neighbor can provide. And they may pop back to see you because you wouldn't do it for them, but they got it someplace else, and they come back to you to fix it, which is...
Fixing someone else's problems isn't always the greatest thing either.
Exactly. That's when you
not
need
something.
to either fire them as a client or, you have to make that choice.
Yeah. So do you think that that's kind of the biggest differentiator right now in terms of, the mass amount of clinics that is out there of people making that decision? Do you think that's what separates a really good clinic from maybe a not so good
Strong
clinic?
to your integrity?
Yeah.
Yes, I do believe that.
And yourself, what do you think?
I
Rita?
agree as well, because at the end of the day, like you said, it's a business, and some people would probably think differently and say, okay, yeah, like I'll sell them something, or I'll sell them a service or whatever, they'll get the results. But the thing is, again, I want to add on to what Dr. Amen said, that afterwards, like you will get in trouble, because if something goes wrong with them, it's just like based on my experience as well in any business. No matter how much a client insists on something that, hey, I want to do this, I want to get this done, like they will do anything on the spot to get that treatment or service done. But if something goes wrong, you're always going to be liable. So I think it's important to make that decision beforehand, like, hey, do I want to go down that route, or do I just want to be like, no, I cannot continue with this, I think you should go somewhere else, and I would highly recommend you don't even go for this.
Okay.
What would you say is like the biggest complication that a clinic may face now? Or doctor?
I wouldn't say it's the biggest complication. Complications happen, and usually you're not liable for a complication. You're liable for failure to deal with a complication and prevent one. Just for general med-spa practice or aesthetic practices, we have common sequelae, I would call it complications that happen with injectables, edema, bruising, swelling. These are very mild transitory issues that usually we have to tell the patients in the consultation about it, and when it happens, it's knowledge. It puts you like as a knowledgeable person. Never ever avoid to discuss it, and this is what informed consent is about.
Right.
We have moderate complications, for example, ptosis of the eyelid in case of botulinum toxin, over-injection and having a frozen face, chemical peeling, we can have scarring, can have infection, lasers or energy-based devices, the same thing. And then we have catastrophic complications, which shouldn't be common, but if it happens, that would be like end of a career, blindness, embolization of retinal vessels with fillers. And again, back to the basics, I think, again, informed consent, proper training of the staff, proper certification of the provider, carrying a liability insurance that protects you from potential complications, because if you don't have any complications, you're not practicing. Each one of us over the years have had some complications.
Right.
And that's why we carry liability insurance to be fair to the patients in case things happen. But preventing complication is the best. So I wouldn't call a major complication that happen across the board in all aesthetic practices, but they usually can be avoided if you use the proper technique, proper sterilization technique, use proper material that's FDA approved or Canada approved, and that's another comment about importing things from overseas. We all know that medical products, because of the trade agreements between countries, are prohibitive. For example, in the United States,
Right.
we cannot purchase Botox from Canada because Canada's Botox is way cheaper. But that can explain why some providers in the United States and Miami, for example, bring their Botox from South America and give it for a fraction of price that we do in Manhattan, and so forth. So avoid going into these vicious circles, because if something happened, there is no forgiveness in aesthetic medicine or lifestyle medicine. Anything can happen, very little. Patients will not forgive you because they're coming there healthy and they just want to look better and function better. And their ability to forgive you for anything that happened is almost nil. So just be careful, because you're going to be the one paying the price if you try to be flexible and save some dollars here and there. This is not a field where you want to do that.
Where you want to cut corners.
Yeah.
I mean, your
Yes.
work is literally being shown,
Correct.
Absolutely,
like
absolutely.
at front and center
Yeah.
constantly. So that's not something that you take lightly for sure, or that a patient would, for that matter,
Yeah.
take lightly,
Yeah.
right? This is fascinating to me, because what is allowed here, as you're saying, Dr. Ayman, is not allowed elsewhere, and vice versa. So what is a clinic's responsibility to do the research and, make sure that they're staying within regulations, but at the same time staying ahead?
Right.
It's like you want to know what's going on and be ahead of it, but you also want to be true to what makes sense and what's allowed and what's healthy or right.
Patients are very smart. Patients are very educated. And patients know exactly about all the laws and regulations. The problem that we face in North America in general, both Canada and the United States collectively, is that because of the exponential growth of this aesthetic trend, and everybody want to look better, everybody want to look younger, everybody's going on TikTok and Facebook and seeing these influencers and want to do this and want to do that, that the growth of the aesthetic industry is going far beyond the abilities of regulatory boards to put safeguards for the consumers. Because in 2002, when we were just few practices performing Botox injections or doing filler injections or doing lasers, the state of New Jersey, for example, state of New York, have regulations. You have to exhibit your licensure. You have to exhibit evidence of your malpractice, liability insurance. You have to exhibit an evidence in order to get insured for this procedure. You have to show an evidence of training. I see that lacking big time currently. And that will give it more chances for errors and more chances for disasters and catastrophes. As a responsible aesthetic practice, moral aesthetic practice that puts patient first and follow the dictum of medical school, first do no harm, you have to follow these regulations ethically. And believe it or not, you might make some more dollar by saving a few bucks on your products, but this usually doesn't last long, because the first time you have a problem, you will pay 10 times
More.
the amount. And that's why you see a lot of them going out of business, right? So my advice for people who are starting a practice or having currently a practice is stick by the golden rules. Don't leave any apertures or ways of hurting yourself or hurting your patients, because if this happens, nobody will forgive you. And lawyers will be waiting at the door. So
That's the only client that you're going to have is the lawyer at your
That
door.
you're gonna have. So speaking of that, we play defensive medicine. We play ethical medicine. First, do no harm. We use FDA-approved materials, purchased locally with the approval of the authorities. Have a pharmacy license in your practice to purchase these controlled medications, and have proper training in order to be able to provide these medications like Ozempic or weight loss medications or IV infusions or exosomes or peptides, whatever you're injecting into a patient. The patient has the right to know the source of it, how you store it. Are you trained to do it? Are you trained to manage complications? Do you really understand the drug that you're injecting in someone's body? And these are my advice to people. Always stick to things that supported with evidence, evidence-based. Randomized controlled trials, not only trials by the company that's selling you the stuff. Don't take opinion from opinion leaders that based by the companies, because they're always biased about their devices.
You can buy an opinion or a review.
So just an example, we just, last October I was in Poland, in Warsaw, and we had a huge review over effective lasers in genital rejuvenation. And the companies in 2012 that started the laser rejuvenation, two big companies, were responsible for most of the publications that publicized the use of laser vaginal rejuvenation. And that's why everybody is crazy about laser vaginal rejuvenation. But now with the presence of 6 other energy-based devices, including high-FEM or chairs, MCELA chairs, radio frequency, and high-intensity focused ultrasound, LED, we find much more comparative outcomes, way better than lasers. So what I'm trying to explain to you is that always try to get your information not from one source that's sponsoring the product or the machine, but from peer reviews and so forth. And this way you will be doing the best for your patients, not from influencers who are not medically educated or trained.
You're right.
Right.
This is true.
Yeah. Have you experienced that when people come in, June, to see?
Yeah. Yes. It's always, there's been many devices that are everywhere based on the fact that, Kardashian said that she gets it done, which I don't even think she does.
Yeah.
But, there's all that hype and influence, and yourself, you're
Exactly.
very much on social.
Exactly. Yeah, I actually do social media part-time, and sometimes I work with influencers that promote really odd things like using, basically taking your own teeth out and stuff. And I mean, of course, I'm not in the dental field or anything, but...
Sorry, we got to pause that for a second. Taking your own teeth out?
Yeah, it's like a thing where basically if you have a cavity, I've seen those videos, and one of my friends was promoting that, and I talked to her, I'm like, don't promote that, because people will actually do it, because she has I'm not going to name her, but she has 1.2 million followers on TikTok, and people will literally do anything she says. And like for my clothing brand, she promotes my brand, right? And the thing is, we get crazy sales because of like 1 or 2 videos that she posts.
Right.
So and it wasn't even sponsored by a brand. It's just she wanted more views. So it's just whatever you guys see on social media. I work with influencers, so I would say just don't even believe it at all, because they're not doctors, they're not nurses. They're just doing it either for views, likes. Again, no hate to them. Like it's obviously their profession, but when it comes to medical grade treatments and anything related to medicine, aesthetic medicine, even medical aesthetics. Like I know there's girls that do microneedling at home with certain devices, like I can't disclose the name, but those are not Health Canada approved. And the only device that I would recommend, and the one that we use at our clinic, is SkinPen, because it was the first FDA approved microneedling device, and it's a medical grade device that's used for microneedling. And plus, you can actually use it comes with a whole kit. So even if it's microneedling, I see girls, and influencers actually, they're like, oh, why pay, I think it was why pay $600 when you can do microneedling at home? And then I see girls commenting underneath the video and saying, hey, can you send me the link please, link please.
Oh,
and there's thousands of comments with links, and imagine how many sales those non-Health Canada approved devices get. And the thing is, I've worked with a lot of manufacturers because we used to work for devices, and a lot of those devices, again, they come off of Alibaba, AliExpress. So they're not even trademarked.
Correct. And then that brings down the actual value of microneedling, period. Because they're going to say, oh, well, I did
The
it.
results didn't work.
I didn't get results.
I know.
But, okay, you did it at home.
Yeah, because that's the whole point of
With
that
an
video.
Alibaba.
Exactly, that was the whole point of our video. It was like a really viral video. It's like, why spend $600 when you can do it at home? And I'm like,
Yeah.
okay, I just skipped.
That's wild and oh so scary.
I know.
to hear that sort of thing.
I know.
Because again, it's the same thing as what you would put in your body, like to eat or drink or medication. Like if you're feeling sick and you were prescribed something, it's like the same thing with your skin and your aesthetic. That should be the same amount of attention. So as a clinic or a doctor, it's a tremendous responsibility to bring people back to reality of what exists and what questions you should be asking. Because often, if there's a deal, it's too good to be true. It's probably too good to be true, and you probably should stay away from it.
It's true.
What's interesting is that in this sense, again, you need to generate revenue. It is a business. This is what this world is. So how does a clinic grow or develop with all of these costs to be in line with all the rules and regulations? And how do you find the balance between business and medicine?
Medicine is rapidly evolving, and medical information with the induction of AI and so forth, and almost 73% increase every other month in the medical knowledge because of the induction of AI and its ability to do this and to do that. Bottom line is, my advice is always to be a leader, not a follower. There is so much new innovations in medicine, in the field of aesthetics, in the fields of regenerative medicine, in the field of senolytic medicine and age reversal medicine. It's up and coming in the next decade. And if your clinic is sticking by the scientific basis, ethical rules, you will always have your clients. You don't have to treat every single person. You only need a few of them. And for 27 years of practice, I only have 18,000 patients that I can hardly find time to see them. So you don't have to treat everyone, but you have to be very selective. In aesthetic medicine and plastic surgery, we have something called a gorniogram. I just want you to transmit this to our colleagues who have Medispas. The gorniogram is telling you that the Hunchback of Notre Dame have a deformity 5 out of 5. But he's hopeless. He knows that nothing can be done. And those are the perfect patients that they have a lot of issues that you feel your training and your background as an aesthetic physician and with your tools that you acquired legally, whether it's injectables, whether it's energy-based devices, you can help to fix that deformity. Versus some patients who have very minimal deformity, she thinks that her cheek is a little bit bigger on the right side than the left, but she can't sleep over it and she can't go to bed because she feels that she's mutilated. And this is a patient who have a deformity 1 out of 5, but her concern is 5 out of 5.
Right.
And these are the patients who you want to refer to your worst competitor. So be picky about patients that you have as patients enrolling in your practice, because they will always be your patient who are loyal and willing to listen to you and be compliant and understand when you say no, the limitations why you say no, while you have to dismiss the other 4 patients that only want the cheapest guy in the corner. Aesthetic medicine is not Walmart. Aesthetic medicine and lifestyle medicine is something for people who want to invest in their own selves. It's not for people who's finding the cheapest guy in the corner. Because if your practice is based on being the cheapest guy in the corner, you will end up either sued or losing your license within a year or 2. So don't ever do that. So how do you develop your practice? How you financially make sure that you survive?
Right.
By investing in things that doesn't require a whole lot of overhead. We already spoke about something. in the workshop that doesn't require us to spend $100,000 to start with. Then once you make some money, you bring a device that you think most of your patients need to use it. You make some more, but you always stick to ethicality, do no harm, stay scientific, stay honest. And patients will know. We've been in practice for aesthetic medicine and surgery in our 4 offices for 26 years. We didn't go bankrupt. But at the same token, we didn't do anything unethical. We didn't bought our Botox in China. Although I travel 280 days a year around the world for the last 10 years. Yes, but I never brought a vial of Botox from my home country, Egypt, back through JFK because it's illegal. Although it's $150 versus $700 in New York. But it is what it is. We have to stick to the law and to the rules in order to avoid problems. And if you put your heart into it and you look at new innovations that's coming and it's really legitimate, it's really studied, it's really proven to be effective to your patients, be the first one to do that. Because patients want you to be the one and only. I want you to always try to work smarter, not work harder. So this is the way you can survive in this competitive environment.
In terms of education, where do people look for the next greatest? Like, how do you even start to differentiate or ask, or then look for the reviews as you go down the filter? But like, where does the clinic start for innovation?
Events like this.
Yeah.
It's events that are put on by other companies, even if you don't have that technology, even if you don't have that product line. Education is education. And then you have it in order to share it if the client comes in to talk about it, or you have it in your knowledge base in case you do need it in the future. It's very important. And share it. Roll that education forward. We often have education evenings for the customer that come in, and we take a small few, and we'll take a device or we'll take a product line, and we go discuss in detail and educate that clientele so that they can go back out and speak properly. They can educate their friends. They can actually are able to be in the front line to say, no, what you've seen on YouTube or whatever your TikTok, sorry, my age. What you've seen, that's not right. I went to an event, she told me, and these are the facts.
Exactly.
So we can at least get the facts out there that are needed in order to differentiate between trend and, of course, science.
For sure. Rita, for you, when people come in and say, like, I want to sign up for this course or I want to learn this, what is like the before and after of people even walking out of there? I can only imagine being like, wow, I was so mistaken or I was so wrong.
No, so we have sometimes we have really odd experiences. Like a couple weeks ago, we had a lady walk in and she was in her like mid-40s and she wanted to do because we had a promotion going on Botox and fillers training. We were doing like a master class setup. And she walks in and she's like, hey, like I want to enroll in this course. And obviously we're going to ask for their CNO license number, right? Because to see if they're even a nurse. And she was like, what's CNO? And I was like, you do know that only nurses and doctors and medical professionals can inject, right? And she's like, wait, what? She's like, no. And it's crazy the things I hear. She told me that one of her friends injects in her basement, but she's not a doctor or a nurse.
Oh boy.
And the thing is, it's very common actually.
Yeah,
I'm not the only one. And the thing
is,
I told her, I was like, no, like you can actually do your research. And she actually got very aggressive because she thought I was doing it on purpose. Because initially she did ask like for a discount and she thought that was the reason. But I'm like, no, you're not even qualified for this because you're not a medical professional. Like, you know what I mean? Like for us, medical aesthetics is very different. Like facials and like even laser hair removal, it's something that honestly, like I've seen random people walk into the field, do their trainings, learn about it, and then start their business. But with aesthetic medicine, it's only for medical professionals. Like there's no exception. Like no randoms or any, like you have to go through getting your RN license, your RPN, or you have to be an MD in order to inject legally. So we have experiences like those where we just send them out. But then we actually have experiences with clients, with our students that want to come enroll in a program, but then they have a problem where they don't want to buy legitimate, like he said, like actual devices from companies. They'd rather buy like a Chinese version of it or like a doctor pen from Amazon. You know what I mean? Like those types of devices. And then when we recommend them, like for example, like my students, we recommend them Regen Lab always for centrifuges. And also I'm very new to them, so I recommend them because I've heard really good things about them and I've actually tried their product. So we recommend companies like these, but sometimes I think it's for them, it's like they're starting off and they just want to save the most. But the thing is, like Doctor mentioned, it's not always about saving. They're going to get in trouble. So I had a student where I actually, this was recent, I referred her to Regen Lab, and she's like, oh, but why are you sending me to buy a centrifuge for this price when Amazon's selling one for $200? And I'm like, those centrifuges aren't even for PRP. Those are centrifuges for like medicine, like, you know what I mean? Like mixing in labs and stuff. She's like, no, I've seen videos and like, I've seen reviews, like it works. And I don't know what plasma forms from those devices, but like apparently it's working for them and their rates are very low because in the area, I live in Mississauga, so we border Brampton. And in Brampton, like it's actually like, no hate to Brampton, but it's known for like the most affordable services. So there's a girl that offers hair PRP plus under eye PRP, and it's a package. So both of these things for $180. I don't know, because the tube cost for us for a centrifuge is like whatever price. Like obviously, even with a promotion, it's a pretty reasonable. It's more. It's like what they would cost, what they would charge for like a treatment. It's not just under eye filler. Like at our clinic, just under eye filler is around like it's 300 plus because of obviously the products and the way we do it, and also we only work with nurses and doctors.
The expertise that you have.
Exactly. So obviously we have to take out that cost and everything, but it's crazy because I don't know how they're making profit, but $180 for under eye filler and hair, like scalp filler.
Blood draw tubes.
Exactly.
You just don't know.
Exactly. And I mean, I don't want to like make this conversation so negative, but the stuff I've heard is crazy where people are boiling like like butterfly needles. They're boiling them literally to reuse them on clients. So that's why, again, I've heard these, not just heard, I've heard them from like people that I personally know. So it's crazy, but the thing is, like Doctor mentioned, it's important to see what clinic you go to, and it's important to see what clients and students you're taking on. Because God knows, like if they go out there and they're doing these things and then they have your certificate at their house or at their workplace, like you will eventually get like in the loophole and you're gonna get screwed over. So yeah.
Those are scary. Those scary things. That's for sure. And like we said, like with the rules and regulations to even safety and to expertise, all of these things can get convoluted and overwhelming, and especially at the rapid pace that all of this moves at, it becomes even harder to control or get ahead of, because as you said, you want to be a leader in what you're doing. My question is, go ahead.
I wouldn't call it be a leader, but at least be picky.
Yeah.
Do not take every patient. If you see 10 out of 10 as consults as patients, you're gonna end up losing your license in a year. Be very selective. Those patients who wants to go Mississauga and get their treatment for 180 should stay there. Because those are the patients who will get back to you for financial gain because they're desperate.
Yes.
You know, if those patients have saved all their life saving for that particular surgery and something goes wrong with the surgery, they will take everything away from you. You don't want that kind of patients anyway.
Yeah.
So please, my advice to you, train well, prep well, present yourself properly and ethically, and retain 6 out of 10 consults as your patients. And if patients want to be, want you to be the cheapest, never. You want to price yourself a little bit lower than the highest in the area. You don't have to recruit every single consult. Some people, again, want the cheapest guy in the corner. But this cheapest guy in the corner probably have no liability insurance if something happens, if they get blinded, if they have a wound dehiscence, if they have an infection. They will come to you for rescue. And I see it all the time. And of course, I don't take them. And at that time, they want to pay all the money that you want, but You don't take them.
Yeah.
So this is it might sound like it's a negative thing, or you go home depressed that you didn't recruit that patient today because he didn't want to pay your price. But trust me, if you look in the future and see that patient suing you because of the littlest problem, you'll understand what I mean. Always use the Gorniogram. It's a typical classic textbook teaching in plastic surgery. We never do every lipo that comes our door. Only 5 out of 10.
And during that consult, it's very important that you show the value that they are receiving by being in your chair or your bed, as opposed to next door.
And sell yourself.
Right.
Very important to sell yourself.
How do you sell yourself?
By showing, people assume, like, how do I sell myself? In the morning, before my presentation, I give her my short resume.
It's not short, for the record.
My resume.
I was going like this.
My resume is 74 pages. My resume is 74 pages.
Yeah.
I gave him my short resume because she doesn't know me from Adam.
Right.
You assume that your clients coming to your shop know who you are. No, they don't. I have been asked recently, what's your name? I said, please walk outside the office and read my name at the door and come back again. Of course, I didn't take her.
Right.
She asked me, what's my name? I mean, you understand? You put your certification, your training, the rolling video in the waiting area is you doing procedures. Every printed material in your table in the waiting area should be about you or the devices you have in the office. Not magazine about gardening or cooking or cars or CNN on TV. Nobody cares about that. People are here to see you, so you should immerse them about your expertise and experience. And that's where training comes handy, because how many people here perform O-shot? How many people do genital rejuvenation with PRP? None. How many people heard about it today from my lecture? How many people are interested to learn about it more? This is what I'm talking about. I wasn't born doing facelifts. I was a cancer surgeon. I was doing Whipples. What I'm trying to explain to you, in the beginning, you're putting foundation of a right practice. And when you put the foundation, you can go 100 stories with a skyscraper. You build up with education and adding little bit at a time, steady, and that's how you're gonna have a long-term successful practice for decades. Don't get diluted and distracted by the noise around you. Oh my God, this influencer said that, or this guy is selling Botox for $229. Yes, one of my patients just texted me, see, why are you charging $900? Because I said the vial is $700 and I'm putting 65 units, so I have to charge $900 so I can pay my staff. The other guy is charging $229. I said, sure, go there. He is buying Botox from China. The vial is $50 in Shanghai. I know, I go there all the time. I know, but I cannot do it because only one visit from New Jersey Department of Fresh and Regulation, I lose my license. And my license is too expensive to lose. You understand what I'm saying? So don't get distracted with all this noise. Just stick to your training, selling yourself properly, advertising yourself ethically, and doing the right thing, and you will succeed.
Yeah. Don't worry about
This
that.
is a field is not going anywhere. This field is only expanding. People are living longer and want more services, but you just have to filter the proper patients. You don't want to take everybody. You want to take the right patients that fits your practice.
This is a recession-proof industry. And when people are feeling bad, they want to make themselves feel better. So what do? You go and do something for yourself. So this is where, I wouldn't say capitalize, but this is where we will always have clientele come to us. Because especially now, in this crazy world that we're living in, that people want even after COVID. People were looking at themselves on cameras. So they transferred
People realize what they actually look
oh
like.
my God, Botox, the fillers, and skin treatments went through the roof after that.
So let's talk about then, to close this all up, where are things going? Say even like 10, 20 years from now, what do you think will be available and where are we going? So many eyes shut off.
I personally, I recently discovered I always knew skin boosters existed, but I recently discovered the hype about it. Because at our clinic, we put a reasonable promotion for skin boosters. So we use Renew by Revenus, and we also use Skin Vive. And those are amazing, but we didn't know it was like so mainstream at this point. It was just something that we kept in the back end, and then we would always advertise Botox, fillers, Sculptra, Radius, all that stuff. But recently we started advertising more skin boosters, and people want to actually like learn about them. So instead of just getting the treatment done, they actually want to take courses for Skin Vive. So we came out with a Skin Vive course. And to be honest, like even with bookings, like people, like as long as the course is a reasonable price, the trainer is obviously qualified, she's experienced. And also like with the trainers, you also have to see how much experience they have. So as long as they're good to go, like people will sign up, but it's crazy how even skin boosters, like I didn't even know, I personally as a business owner, I didn't even think that course would sell. Right, because it's a business at the end of the day as well.
Yeah, of course.
But the skin booster, like it's going amazing. And with the only two products we use are Renew by Revenus, and then we use Skin Vive, and it's going amazing. So yeah, I think in terms of like regenerative aesthetic medicine, people, especially the younger generation, they're gonna go towards things that are not gonna modify their facial structure, or like for example, there's a lot of like obviously controversy on filler. Filler is amazing. Again, it's for whoever needs it. It's amazing, but at the end of the day, the skin boosters, they're like, my dad gets skin boosters done, and this guy doesn't even get facials done. So the thing is, if he's okay with skin boosters and he sees the results, like after like, a few weeks, he's like, wow, like my skin's glowing, it looks smooth, it looks like this, like that. Whereas I feel like with filler, again, people are always saying this, certain things like, oh my God, like it did this, that happened, or like a lot of girls are like, oh my God, I got done. Like there's just so much going on with it. But skin boosters and like even like PDRN, so VAMP. VAMP, again, obviously we're not allowed to inject it, but even topically, like microneedling with it, it's amazing. So again, it's like newer things that people are going to, because again, like my generation, like people that are Gen Z, they are more into skin boosters, VAMP.
Yeah.
And apparently,
it's like enhancing what you have or taking care of what you have instead of changing what you have. Because I feel like for quite some time it was rearrange my face.
Exactly.
Right?
Since Homo sapiens came to Earth 300,000 years ago until the 1800s, medicine was ablative. You get pneumonia, you're dead because there's no antibiotics. You crush your hand, they cut it off. Since the late 1800s until now, and everything that you went to med school and nursing school to learn is reparative medicine. We do surgeries. We remove liver. We connect tendons. We reconstruct crushed. We reconstruct things. We put a heart transplant. Since 2017, with the advance of Harvard work with Professor David Sinclair, a new era of medicine have started. We're only 9 years into it. Spare part medicine. When you crash your Mercedes, they don't take it to the body shop anymore. They replace parts. They replace the bumper. So aging, like I said in my previous presentation, is a disease. Aging is a pathology, have pathogenesis, genetic and epigenetic, which is your barcode that you inherited from your 300,000 years old ancestors, your histones, your telomere responsible for your cellular division, your hormone, that drops and your cortisol that increases, your sugar that glycosylate all your proteins, your mitochondrial failure. All these mechanisms are now on the verge of being fully treated with oral tablets, senolytics. Senolytics will transform your practice. Regenerative medicine, utilizing the advent of adipose-derived stem cells, will allow us to make new heart. So we don't need a heart transplant. Will give us a new knee at the age of 90 for another 90 years to walk on. So we don't need a knee replacement surgery. It will change the field of medicine. So what I see coming in 2027 and upwards is what every single one of you should be thinking. You shouldn't be opening a practice to inject Botox and fillers. You should be opening a practice for regenerative/senolytic medicine that reverses your age and make you function younger every year backwards. This is the future, and it's here to come very quickly, faster than you imagine, if the world's still here in 2027.
And I do completely agree with what the doctor is saying. Regenerative medicine is where we are going in this industry, where I've always felt it should have gone even many years ago. Instead of masking or putting a Band-Aid on something for temporary fix, we need to make the body do what the body is known to do. We go to the gym, we work out our bum. This is the same.
Yeah.
We need to work on this in a manner that it's going to continue to improve on its own.
It's our next TV program to talk about how can we live forever.
Yes, perfect.
How can we live forever?
Sign me up. I'll watch it all day, all night.
Why do we age and why we don't have to?
Yeah.
Why we age and why we don't have to?
I think our next step is also the next few years is AI. We all need to use it more than ChatGPT. AI is going to run our clinic. It's going to answer the phone. It's going to book the appointments. It's going to do our social media. It's going to maintain that client up until it actually sits in your chair with you. So we need to be we need to be smarter. We actually do need to take some courses on AI so that we understand how we can use it to the max and fully grasp it. Because it's just, we just know a blip right now. We don't know it.
Right.
So we do need to harness that energy.
Yes. AI diagnosis and treatment, currently accuracy is 97%.
Wow.
Human doctors, diagnosis and management, accuracy is 64%. Within 5 years, most primary care physicians will be obsolete. There will be no primary care doctors. It's all AI jobs. They get your labs, they send you for radiological investigation, they prescribe your treatment modality, and you just go to get it done. There will be no intermediary doctors. So wake up.
I actually wanted to add on.
Of course, girl.
Yeah, that's what I was going to say. So actually 2 things. It's crazy how he mentioned that. I started smiling. So my family doctor, I've been going to her for 11 years, I think, since I was like 14. And recently I was saying because I'm a heart patient, so I have to explain everything, follow up with her every 3 months. And it's my family doctor. So I was saying so much stuff to her. I'm like, why is she just listening to me? Like, why is she not writing down notes like she normally would? And I'm like, hey, like, how do you know what I'm saying? And she's like, oh, it's AI. And I'm like, what? And she's like, oh, so my computer, we have like a system installed with like a microphone. So whatever you're saying, the AI like system that's integrated into our computers is listening to it. And it's basically making me notes. It's gonna, yeah, exactly. And it's gonna send me, it's gonna recommend me like the next steps for you when your next appointment is gonna be scheduled at what do you call it? St. Michael's Hospital. And I was so confused. I'm like, wait, is this a joke?
No, there's not.
And she's like, no. And I asked her, I was like, so what's the, like, respectfully, I was like, but what's the point of you being here then?
Yeah.
She's like, no.
So this is another application for all of you. When you have in your practice, please don't call your lawyer for consent forms. Don't ever do that. You have to ask ChatGPT to write you pre and post procedure instruction to the patients because it's updated daily with the latest medical legal requirements in your area. You understand? So you just put down, please write me pre and post-operative instruction for labiaplasty in the state of New Jersey. And it will give you the most up-to-date, medical legally competent format. You print it out with your name on it and you hand it to the patients.
Yep.
Simple application for all of you to use, whether you're doing Botox fillers, Plexar, Neogen, whatever it is, this is the way to go. Just to start.
Exactly.
Work
About
smarter.
efficiency.
Yes, it's all about
Exactly.
efficiency.
Yeah.
Time is money.
Time is money.
And half of the information I give you today was from AI.
Are you AI? Maybe. Are you here? He's a hologram.
Elon Musk is my cousin. No, I'm Egyptian. I wish I am, but I'm not, no.
Give our panel a big round of applause. Thank you all so much. That was fantastic. Super helpful, very
Thank you so much.
educational, and we
Thank you,
appreciate
thank
your expertise and your visionaries.
Thank
again.
you.
Thank you so much.
Yeah,
Thank you.
thank you. All right, don't go anywhere. We're going to take a short break, and then we have a presentation from Rita coming up in just a few minutes. So we'll be right back.
Excellent.
Oh, and
Demo
a live
and a demo.
Yes.
Yes, exciting
Okay.
demo.
Thank you.
Thank you.
Oh my God, my legs. Let's go.